Let's start again.
Okay.
A
Okay.
26-year-old primary gravida woman comes to the office for a routine prenatal visit. The patient has a Ehlers-Danlos syndrome and is worried about her pregnancy. She read an article about pregnancy outcome in women of similar age with Ehlers-Danlos syndrome and wants to discuss the result. The study The study compared perinatal events in women with Ehlers-Danlos syndrome to those in women without Ehlers-Danlos syndrome. A summary of the results shown below. Based on the study, which of the following is strongly justified? Okay,
Ready?
wait 1 minute. How you
Okay.
found so quickly? Can you hear me?
Mm,
Am I
yeah, I
okay?
can hear you.
Okay, sorry.
Mhm.
Strongly justified. Okay, let's see.
Okay. So it's B, as in boy.
Okay,
ETS significantly increased the risk, the odds of amyotomy. Um,
why it is B?
okay. Okay, you read the explanation.
Okay,
You're the one that wants. So you read everything.
okay, no problem. The odds ratio is a measure of an association used in case control studies to compare the odds of exposure in case individuals with the disease relative to controls. Individuals without the disease odds ratio is odds of exposure in cases divided by odds of exposure in controls. The odds ratio less than 1 indicates the exposure is associated with decrease in odds of the disease with respect to the exposure. That is, the exposure is a protective factor. Odds ratio equal to 1 is null value indicates there is no association between the exposure and the disease. And odds ratio more than 1 indicates the exposure is associated with increase in odds of disease with respect to no exposure. The exposure is a risk factor. The confidence interval The confidence interval of an odds ratio indicates with an certain confidence level where a given odds ratio is statistically different from the null value odds ratio equal to 1. A confidence interval that includes the null value is not statistically significant, and the confidence interval that includes the null value is statistically significant at the confidence level. In this study shows Ehlers-Danlos syndrome increase the
Wait,
odds. Sorry.
before you continue, does before you start the next thing, does all of that make sense? The what you just read, the odds ratio to the confidence interval. Does that,
Explain.
that
Odds ratio equal to 1 equal to that means there is no association. This is simple,
Mhm.
isn't it? And less than
Mhm.
1 indicates the exposure is associated with a decrease in like okay, explain, you explain.
No, you explain. So so you get it. If I see that I would tell you, okay, maybe no, maybe like this, but I feel like if you explain it, then that means you get it. You are able
Okay.
to say.
Odds ratio less than 1. It means that exposure is associated with a decrease in the odds of the disease,
Mm-hmm.
and more than 1 is associated with increase in the odds of the disease with
Okay.
respect to no exposure. Yeah.
Okay.
Okay. And in the confidence interval, the odds ratio, uh, okay, you explain from this like why it is statistically significant. The confidence interval one.
You already know if it includes. I think this sentence is just trying to say if it includes one, then it includes the new known value, and then you know that is not statistically significant. If it doesn't include one, then it doesn't include the new value, then it's statistically significant. That's all this is trying to say. I'm thinking.
Okay.
Does it make sense?
Yes.
Mhm. Okay. Now next. You can keep
Okay. In this study, results shows an Ehlers-Danlos syndrome increase the odds of amniotomy because the odds ratio more than 1 amniotomy because the odds ratio more than 1. The change odds ratio 3.5 compared to the odds ratio 1 represents an increase in 250%, like 3.5 minus 1 divided by 1, like 2.5 into 100, like 250%. So when we find any odds ratio, we have to compare with the given odds ratio. Like our odds ratio should be 1, which is statistically like how this is calculated. This one.
No, I think here this is not I think here they're just trying to tell you what is it that this is the answer. B is the answer because
Yes,
amniotomy odds ratio is 3.5. This doesn't fall. There is no one, so it's statistically significant. And now they're trying to say the answer says that the amniotomy the odds is about 250. So they're trying to tell you how they calculated the 250.
250. Yes.
But you already got the point. You already got why this is the amniotomy is the answer, right? You you get that part. Like the amniotomy is the answer.
Why amniotomy is the answer? Because odds ratio is more than 1.
No, no, because the those are the only two where the confidence inter all the other ones you see the confidence interval includes one. So
1,
all the
yes.
other ones are not statistically
Still
significant.
significant. Only the induction of liver and amniotomy. It does not include
The
1.
Yes, so only those ones are statistically significant. And
Okay.
the question was which one of the conclusion is true. So we know that this one where it says preterm birth, blah 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 is true. This is not true because this is not statistically. So we can take out. You don't have to read. You can take that out already. We know that small for gestational age not statistic, so you can take that one or you don't have to read that. We know that the odds of which one? Wait, no statistical significance. We know that this is not true. We know you just said these two are statistically significant. So this you can already take this one out. So you are only left with those two. This one
The B option B.
and option. Why is my thing not working? Wait, sorry. Option B and option D because it's
Yes.
here it says the labor induction of labor is statistically safe, which is true also. So now you have to find the difference. Here it says induction of labor is 30%
30%
higher
higher.
in women with yeah, and here it says odds of amniotomy is higher in EDS by 250. So now we need to try to figure out where the 250 and the 30 what's the difference, why one is true and the other one is not true. I think that's what they're trying to explain on this thing. Why the 250, where the 250 came from. That's what they're trying to explain here.
Okay.
Hmm.
So how this is the way of calculating the percentage from odds
I
ratio.
think from odds ratio, yeah, I think that's what I mean. Yeah, I never seen it, but I guess yeah, that's the way of calculating the percentage from alteration. Mm-hmm.
Okay.
Mm-hmm.
The calculation are based on the principle that an odds ratio equal to 1 null value does not increase the odds ratio equal to 1 corresponds to 0% change in odds. So an odds ratio equal to 2 increase the odds by the 100%, not 200%, and so on. Similarly, Ehlers-Danlos syndrome also increase the odds of induction of labor by 190%. Induction of 190%, about 200%. 2.9 compared to 1 or 95%, 1.9. Okay, this like in here, sorry,
Yeah, I can hear you.
yes, in induction of labor odds
Mm-hmm.
ratio is 2.9. So 2.9 minus 1.
Mm-hmm.
So what? So
So what?
point 0.9, 1.9.
Mm-hmm.
1.9
Mm-hmm.
into 100. That means
Uh-huh.
190%. Okay.
Mm-hmm.
So it is not 300%. So that's how we can calculate. Okay.
Yes.
Now I got it.
Okay. That's what they were trying to say. And you
Yes.
did choice A and C, we already know why it's not the answer.
Yes.
Then here, I think you already explained this one. You already explained that one.
Okay.
So we got that. This is what you just read. So it's
Yes.
fine. But and then, oh shoot, here you already seen that answer. Sorry.
No, no,
Okay.
I haven't seen the answer because I can remember the answer.
Okay. It's odds ratio a measure of risk, true or false?
What does the measure of risk means? Is odds ratio is a measure of risk, true or
Yeah,
false?
that's the second
False.
answer. False. Yeah. But
Why?
odds ratio is a measure of what?
Odds ratio measure of what?
Okay. Risk ratio is a measure of risk. So odds ratio is a measure of what?
Case control.
Okay, yes. But basically, like risk ratio is a measure of risk. So odds ratio is a measure of odds.
Odd.
Yeah. Yeah. The risk ratio. You say the word risk is in risk ratio. So odds. Yeah, but whatever. It just makes sense to me when I say it like that. Never mind. Don't worry. Don't worry about it. Okay. So yeah, you can keep reading.
Okay. So odds ratio is a measure of association of case control study to compare the odds of exposure in case relative to controls. The odds ratio is not a direct measure of risk. What day is today? Oh, sorry. What day is today for you? Is it Thursday or Friday?
Thursday.
Okay.
Mhm. Okay. Next question.
Next. A 31-year-old woman brings her 18-month-old son to the pediatrician for a well baby checkup. She is extremely concerned that her child has been gaining weight at an accelerated pace. She asks how her son's risk of developing childhood obesity before his early school age years compares with that of the children who gain weight at a normal pace. Which of the following is the type of study design? Developing obesity. There is no disease, isn't it?
Mm, the
Case
obesity.
control is like disease versus non-disease, and cohort is the relative risk.
Okay. Mm-hmm.
So
So
in
what do you
here,
think is the answer?
It may be a case of cohort.
Case of cohort. Okay. Okay.
Oh,
Thing is cohort.
okay. I
They're
don't
asking
know.
what. Okay.
I don't
Yeah.
know actually. So,
They're asking what
what's your
type of
answer?
study design will best answer the question. What type of study design? Okay, let's do cohort. I'm thinking cohort. The answer. What is the answer? Okay, I guess it's cohort because it's talking about cohort in educational thing.
Okay.
I
Then we
think we'll
are
do cohort.
then we
We
are
are
right.
right.
Okay.
Okay, read.
Okay. Should I read study? Should I start reading?
Yeah, huh? Yeah, sorry. Go
Okay.
ahead.
You are scrolling. That's why I am asking you.
Oh, I didn't know you were reading from my thing. Okay,
I am
sorry.
reading from your thing and my thing
Oh,
also.
okay. Okay.
I was watching what you are doing.
Okay, sorry.
Okay. Observational studies are broadly classified as having a descriptive or analytic design. Descriptive design, case report, case series, cross-sectional describe patterns of disease in population by time, place, and person. These studies help generate hypotheses about association between the risk factors and disease, such as in a study showing that a high proportion of people with lung cancer are also smokers. Analytical design, case control, cohort, and some cross-sectional design test hypotheses about association between the risk factors and disease, such as in a study that determines smoking is a statistically significant risk factor for lung cancer. The choice of study to design a specific research question is guided by study's objective, the disease of interest, and its apparent association to risk factor and feasibility constraints. In this question, the mother of 18-month-old child who seems to be gaining weight at an accelerated pace is concerned about her child's risk of developing obesity, helped with that of the children who gain weight at a normal pace. These suggest that the mother identifies the accelerated weight gain in young children at, as a potential risk factor for childhood obesity. To answer the mother's question, the study design would have to test a hypothesis about the association between the risk factor accelerated weight gain in young children and disease childhood obesity. Therefore, the study must have analytic design. Choice B and C. The analytic study compares the risk of developing disease childhood obesity between the exposed young children with accelerated weight gain, non-exposed young children with normal weight gain. Is the cohort group is the cohort study. Okay, you wanna add something?
Um, can you read A case
Yeah,
control, please?
yes. A case control study is an analytic design in which potential participants are initially identified based on disease status as case with disease or controls without disease. Once case and controls are identified, the presence of the past exposure one or more than one of the risk factors of the interest is determined in each group. Because cases by definition have already have the disease, case control studies cannot calculate and compare the risk of developing disease. Okay.
Okay. Mm.
You
You have any questions here?
yes, like when you
Uh-huh.
see this type of question, what
Mm-hmm.
you think, like case control and cohort, like how you pick up,
I don't.
like you see this question, like what the parameters you have seen to find that this is case control or cohort. You got my question, like what you
No,
have seen in this question to find to found that this is cohort.
I didn't really. I mean, it was asking me for the study design to use.
Like I follow the tactics,
Uh-huh.
like case control is
Mhm,
always disease versus non-disease, like there is a comparison in case control studies. There is a
mhm,
disease group, there is a control group. But in
mhm.
cohort there is both of them are healthy, but there is additional risk factor that causing the cohort.
The additional risk factor that's causing the cohort. Okay, okay, you can
Like
say
in
like that.
here nobody is diseased in this question. uh,
Mm-hmm,
in this question there is no diseased person in there. In this question there is like obesity, one of the risk factor, and it is like the obesity. For the obesity, some people who are exposed to obesity they are getting more disease, and the people who are
mm-hmm,
not gaining or
mm-hmm,
gaining normal weight they are getting less disease. So there is no
mm-hmm.
diseased person, there is the risk factor, so that's why it is cohort.
Okay, yeah, you can look at it like that. Yes.
Okay.
Mm-hmm. Okay, next. Oh, I think those are just okay. Read them. Those are just like key points.
Hello, yes.
Yeah, read them. I guess just
Okay.
those are just key points. Read it. Mhm.
Case control studies always retrospective versus cohort that can be either prospective or retrospective.
That makes sense, right?
Sorry, yes. Case
Okay.
control is always retrospective, but cohort is either prospective or retrospective.
Mhm,
And cohort versus case control, which is the most appropriate study design for rare disease. The case control study is the most appropriate analytical design to study uncommon rare disease. Case control for uncommon rare disease and
mhm,
disease with a long latent period. Case control versus cohort, which studies are more affected by recall bias, inaccurate recollection of the past in event, also called recall bias, is a potential problem for case control studies, not the cohort studies, particularly when questionnaires are used to ask participants about distant past exposure. Basically, patients with disease are always more likely to remember the exposure. Case control versus cohort or randomized control trial. Which study is less time consuming? Case control study is less time consuming and less costly to other study design. So case control is less time consuming. Case control can diagnose the rare diseases,
mhm.
and case control has a potential problem for recall bias.
Yes. Does all that make sense?
Yes.
Okay. Perfect. Let's keep going.
Okay. So you read this flowchart, then I can.
Oh, Okay, this was one of the videos. He says that the different type, how to find which study design you want to use.
Okay.
Or which study design is the question talking about. You first start by seeing are the patients randomly assigned to two different groups. Randomly assigned. Does the researcher assign the patient to the groups? Yes. Then it's randomized control trial. This makes sense, right? Uh, when you randomize, you say people, I'm going to put 5 people here and I'm going to give them drug X, and I'm going to put 5 people there, and I'm going to give them drug Y. So you randomly assign. That's the RCT, the clinical trial. We already know patients are randomly assigned to the placebo and to the treatment, and then you check the outcome. The the thing that you use here is risk ratio. The measure of association that you use here is risk ratio. And they are saying randomization is good because it equally distributes the confounders, so it takes away the confounders. So that's why randomization is good. So you got this part right.
Yes.
Okay. Now, patients are not randomly assigned to groups. So you researcher, you are not assigning the patient. Then we go to this side. Then we're asking if the patient are not randomly assigned by, okay, they are not randomly assigned to groups, so we already know that. So what strategy are they using? Are they grouped by exposure status? So do you pick the patient based on the exposure status? Yes, then you are doing the cohort study. And remember, it can be prospective or retrospective. So you are initially selecting or dividing the patient based on exposure and not exposure. And then you follow them and then you check the outcome. Of course, this is the prospective one. Right? You follow them and you check the outcome. The measure of association that you use here for cohort study is risk ratio. Now always remember R for risk ratio and O for odds. I don't know if that's how you remember it, but that's how I remember it. The R for risk ratio and then the O for odds ratio. I don't know. So here was when you group the patient, not, I don't want to use group because group is here. Here is when you select the patient based on exposure and non-exposure. Now, when you select the patient based on outcome status, then you are using case control. So here you start, instead of starting here with exposure and following for the outcome, you start with the outcome, positive outcome, negative outcome, and then you ask the patient if they were ever exposed. Um, and then you already know the measure of association is the odds ratio. A key difference that the guy was saying on the video is that in that you just read it, case control is good for red outcomes. So red diseases. So a disease that's not it's not in a lot of people, it's not study, whatever. So if you have to follow somebody for years and 10,000 years to, it's going to take a lot of time. So you just find the one person that has the disease and you just check the exposure. That's why this is better. So we already done this one. When you select by exposure, when you select by outcome. Now, if we don't select it by exposure, we don't select it by outcome, we don't use any of those, then it's a cross-sectional studies. And then cross-sectional studies, the measure of association is prevalence. So here you are looking for both the exposure and the outcome at a specific point in time. So you find the patient on the street and you ask them, hey, do you have cancer? Patient says yes. Have you ever smoked? Patient says yes. Just that one day, that one time that you find the patient. You don't follow them, you just ask them right there. And that's it. You check it, you put it in your notes, and that's it. That's cross-sectional analysis. And here the measure association is prevalence. It's not that's all. Oh, and then he was going over those extra study designs that sometimes comes on the exam. So this one you have randomized clinical trial. These ones are called observational studies. Those one the cohort whatever, and then those ones are called, I forgot how did he call them, but anyway. And then those the case series. The case series is just you just take a few patients. It's a rare disease like a cancer of, I don't know, the teeth. I don't know. So you just find the five people that you found that have the cancer, and you try to describe um, the symptoms of the patients or the course of the disease based on the small number of patients that you have. Yeah, this is just for rare diseases where you don't have a lot of patients, I guess.
Okay.
That's why N is less than 50. And then ecological study, you already know that is when you don't analyze the patient, you analyze like a group level. So all the patients in, I don't know, India, instead of like the patients in, I don't know, you get what I'm saying. When you
Yeah.
analyze not at the patient level, but at the group level. Like all the patients in LA
Like area
instead of
based disease.
area-based disease, yes. Yes. So that's all here. And then now question.
Like, okay, study design. You are evaluating possible association between hot tub uses and the development of interstitial lung disease. Using data from 2000 to 2010, you compare rates of ILD development between patients reporting hot tub usage compared to those denying hot tub uses. What study design was used and appropriate measure of association?
So which one do you think?
ILD development, the patient using hot tub disease and the patient is do not using hot tub disease, isn't it?
Mm-hmm.
Is it case control?
I think it's, I don't know. I think it's cohort retrospective. Let's think about it.
Or
How,
isn't it prospective like 2000 to 2010? It is going forward, isn't it?
but you don't know if we are in they were in 2014 and they just went to use
They
data from
said
2000.
using data from 2000 to 2010. Okay,
Yeah,
you can go backward also.
yeah.
So you are thinking that it is cohort.
I think I don't know. Maybe I think it's cohort, but because okay, let's think about it. How did they select the patients? Based on exposure or based on outcome? I'm thinking based on. Hmm, hmm, I'm thinking it's okay. Maybe you're right. Based
They are based on
outcome.
outcome, isn't it?
On outcome. Yeah. Right.
Like
Right.
the
Like.
people who have ILD,
Uh
then they
huh.
are using hot tub, and the people ILD without using hot tub.
Okay.
Am I right?
There's this. I think so. Okay. Let's look at the answer. I don't know. Okay. So it's cohort. So I guess they selected based on exposure.
Like the people who are exposing hot tub, they are getting ILD. The outcome is
Mm-hmm.
ILD and exposure without exposure.
I think it's retrospective. You see how they're probably in 2014, okay, and then they selected um hmm, they selected the exposure, the people that hmm, mm, wait, how did they go for cohort for uh, I get why the cohort, but I don't get
Retrospective or
uh,
prospective?
retrospective of her head. Yeah, I don't get it.
They haven't specified a specific time travel. They are using
Yeah,
data from 2000 to 2010.
yes. So I'm guessing they are selecting, okay, hot tub exposure and not hot tub exposure. And
Okay,
then they went back into they went to look.
so we are in 2025. So we are
Okay,
using
let's
data of
say
2000
mm-hmm,
to
to
2010. Then
2010.
so it is
Okay,
retrospective.
okay, retrospective. So they pick people that have the interstitial lung disease, and then they went back to their charts from 2000 and 2000 between
10
2000 and 2010, and then they check if those people were using hot tub or not.
probably
Is that
yes.
what it is?
Yes. That
Uh,
that's the thing only
a
makes
bit
sense.
confusing. Yes, that's a bit confused because that looks
Case control.
like face control, right? Because they selected first the outcome, interstitial lung disease, and then they went back. I guess I'll go look at the video again for this one. But yeah, this case in cohort. But it cannot be case control also, because case control you will have to have two groups, the
Disease
positive
versus
alcohol
non-disease.
and
Like the
yeah. So
patient
you
with ILD and without ILD.
and without ILD. And here they are only giving you the patients with
Yes,
ILD.
ILD.
The only thing that is changing is the hot tub versus the not hot tub, which is the exposure. So you know that right there it cannot be case and control. But that
Yes.
then the key is, I guess that well they didn't ask you that here if it's retrospective or prospective, but the key is it cannot be case control, so you know it's cohort. Yeah. Okay. Okay. Next.
Okay.
Does it make sense? You have to tell me if it makes sense because we're
No, no,
doing
it,
this
it,
for you.
it makes
Okay.
sense. I'm thinking.
Okay. Good. Okay. Good.
Okay, it's cohort. So next, you are evaluating possible association between exercise and type 2 diabetes mellitus. You send survey of 1000 households asking individuals to report whether they exercise more than 3 days per week or whether they have type 2 diabetes mellitus. Which study design and mechanism of action?
Oh, sorry. It's measure of association. Sorry.
Sorry,
I don't know why. Yeah, I don't know why he abbreviated. Yeah, I don't know why he write.
no,
Yeah.
no, I made mistake. Okay.
No,
Uh,
because that no, I'm with you because that's how I write my mechanism of action to MOA. Like if you see my notes, that's how I write it. So I did the same thing when I was listening to his video. I was like, wait, mechanism of action. But then he was like, oh, it's measures of association. I was like, okay, whatever. Like, yeah, okay. So which study design if and which measure of us do you think this is?
exercise and type 2 diabetes mellitus. It is also cohort, isn't it?
No, think again.
You are evaluating association between exercise and type 2 diabetes mellitus. Uh,
They're already doing the studies already here. They found they send a questionnaire to like 1,000
1000.
houses and they ask them, okay, check here if you exercise 3 times a week, and then check here if you have type 2 diabetes. And then they collected the questionnaire, and that's it.
So this is case control.
No, go back to your diagram, your log algorithm. Are they randomly assigned to treatment groups?
Yes.
So in this study that you just read, are the patients randomly assigned to treatment groups?
Then it is RCT, randomized control trial.
No, no, I'm asking you. Sorry, I'm asking you if in the study that you just read, are the patients randomly assigned to treatment groups? Yes, no, because
You
that will depend on what way you're going. Are they assigned to treatment groups? Yes or no?
no, they are not randomly assigned to the treatment group.
No, perfect. Because randomly assigned, you already know is when you give a drug, placebo, treatment.
Placebo and
Blah.
yes,
Yeah. So no, okay. So we're going this way.
yes.
So the group, so the selection, are they selected by exposure and not exposed?
No.
No, so we know it's not cohort. Are they
Yes.
selected by outcome and not outcome?
No.
No, so we know it's not case control.
So it is
Is
cross
it like
sectional.
perfect? You got it. So what's the measure of association here?
Prevalence.
Prevalence. Yep. You see, that's kind of how he uses the algorithm in the video.
Yes,
Let's
that's
see.
great.
Yes. Okay, so it's cross-sectional and prevalence. Does it make sense? What do you think?
Yes.
Okay, perfect. Next.
Okay. You are evaluating possible association between X. This one, sorry, question three. Sorry.
Mm-hmm.
You are evaluating possible association between tobacco use and rare form of lymphoma seen in 1 by 1 million patient. What is the most appropriate study and uh, general approach of this study and mechanism of action? Okay, it is case control because rare
Got it.
disease,
You
and
got it.
in here there is no randomization. No
Yep.
randomization, then we will go case control, cohort, and cross sectional. And we know that cross section, sorry, case control deals with the rarest disease.
Okay.
Case
What's the
control,
measure of association?
odds ratio.
You got it. Perfect, perfect. Next.
Yes. Okay. A case control study evaluated whether the length of the anogenital disease, a biomarker in utero, prenatal androgen exposure is associated with the presence of endometriosis. Cases n equal to 114 where women diagnosed with endometriosis attending the endometriosis unit at a local hospital. Control n equal to 105 were women without endometriosis attending the gynecological outpatient clinic for routine gynecological examination at the same hospital. Participant completed a health questionnaire and underwent physical and gynecological examination including transvaginal ultrasound, measurement from the upper verge of the anus uh, to the posterior fourchette. Posterior fourchette were obtained in all subjects. Logistic regression was used to estimate the unadjusted and adjusted association between tartles, anogenital disease, AF measurement, and the presence of endometriosis, with tartile 3 used as a baseline. Results of anogenital disease are shown in the diagram below. Based on these results, which of the following is the most appropriate? Conclusion. What is the answer?
Mm. Statistically significant is
Significant.
true, and also as the distance. No. Only measurement on the first step. Which one do you think?
No one.
No, no, it cannot be no one. Okay, let's try to go one by one. Okay, let's come up with the answer together.
Okay. Age, BMI, vaginal delivery episiotomy distorted the true association between the anogenital disease and endometriosis.
Okay. We know on these things we always try to look for the when you get one of these graph and they give you adjusted and unadjusted, you always try to look for the adjusted thing. We already know that because the adjusted means the confounders are taken away. So the things that can distract the study or make the study wrong are taken away. But okay, this is not the case. But I'm just saying in general, if you see a thing and they give you adjusted and unadjusted results, always look at the adjusted.
Okay.
Okay, you just read that. The first statement says all these things distort the true association between the distance, whatever thing, and the endometriosis. Is this true or not? This is basically what they're asking you. Okay, let's look at the this will be the little triangle where is all the age, BMI, vaginal delivery. They're saying that the studies, those things are distorting, are breaking the association between endometriosis and all that. Let's look at the triangle here.
Yes.
It includes one, so kind of yeah, it's breaking the association because one is means there is no association there. The null value is included. You see the null value here
Yes.
one, so there is no association. So okay, this one agrees with this statement. Okay, let's look at tertile two, and we are only
Yes.
looking at the triangle, right?
Yes.
Because the triangle is
It is
yeah.
adjusted.
So
Yes.
yeah, it's adjusted, and that's the one that yeah, because the square is only the age and BMI, and the circle is unadjusted. So the triangle is the one that includes BMI, vaginal delivery, and episiotomy. That's what we're looking at triangle. If we look at here, yeah, the triangle is up here in three, but
Eh,
look at the confidence interval, the line. It includes one, right?
yes.
The line. Yeah, so it's probably not statistically significant also. So yeah, it goes with this statement. So that's perfect. Okay, the statement is true in those things. But now let's look at this one, the triangle here. It's up here, so it doesn't include one. And the confidence interval, the line, doesn't include one
In
too.
one, two.
So it goes against this statement. So this
Yes.
statement is not this statement cannot is not true because it's true for these two, but it's not true for that one. Does
Okay.
it make sense?
Yes. Yes. It makes sense.
Okay. So let's take this one away. That's not that answer. Next one, read it.
Compared to anogenital disease measurement in the tartile, in the third tartile, anogenital measurement in the first and the second tartile are significantly associated with endometriosis.
Okay,
Only
so now we
first tartile is significantly associated, not the second
uh-huh,
tartile, because it
and
includes one.
not the second one because
Yeah.
not the
Third
third
one
one
also,
is
yes.
is it significant or not?
No, it is not
Is not.
statistically significant, yes.
So is this statement true or not?
False.
False. So we're taking it out.
Okay.
Okay, let's go to C.
Only anogenital disease measurement in the first tartile are significantly associated. Okay, this is right.
This is right. Let's go to D. This is one of our. We're going to keep it here. We think it's right. Let's D.
There is statistically significant increase in the odds of the endometriosis as anogenital distance increases. Okay, how we can exclude
As
this?
you see, tertal 1 is 19.7 millimeters.
Yes.
Tertal 2 is 24.8 millimeters, so it increases. Tertal 3 is 31% millimeters. So this is the size of the anogenital distance, whatever. So they are saying as you increase from 19 to 24 to blah blah blah, there is the result is more statistically significant. Is it true or not?
No, it is false.
It is false. So we are. taking this one out. So we think the answer is what?
C.
C. C. Let's check. And it's C. You see how we did? We went through each kind of how we went through
Yes.
each one. Yeah, that's kind of how I kind of always do it. Okay, now you can read the answer choice.
Okay, odds ratio is the odds of exposure anogenital distance from the anogenital distance from the posterior forecheek to the upper anal verge of anus. In cases, women with endometriosis divided by the odds of that exposure in controls women without endometriosis. The confidence interval of a given odds ratio indicates with a certain confidence level whether the odds ratio is statistically different from the null value odds ratio equal to 1. Any confidence interval that excludes the null value is statistically significant. Odds ratio may be adjusted or unadjusted. An unadjusted odds ratio estimates the association between an exposure and outcome but does not account control for the effect of variables known as the confounders demographics of the outcome. An adjusted odds ratio controls for the effect of the confounders. Therefore, adjusting minimizes confounding and provides better estimates of the association. The study provides the odds ratio for several levels of exposure, tertiles of the anogenital disease measurement among women with or without endometriosis, and genital disease measurement in the third tertile are considered baseline odds ratio equal to 1. The symbols circle, triangle correspond to the point estimates of the odds ratios, and the lines correspond to the 95% confidence interval.
Wait, before you continue, does everything you read so far make sense?
Yes.
Yes, perfect. Okay, keep going. Keep going.
Compared with the third percentile, compared with those in the third tertile, women with anogenital disease in the second tertile were not more likely to have endometriosis because all 95% confidence interval cross the horizontal line corresponding to the odds ratio 1. In contrast, compared with those in the third tertile, women with anogenital disease in the first tertile were significantly more likely to have endometriosis because of odds ratio were more than 1 and none of the confidence interval crossed the horizontal line corresponding to odds ratio. Exclude the null value. Okay, now it
Okay, I
makes
think we
sense.
don't need to read. Yeah, we don't need to read the choice A. We went through
Yes,
that when we were. Yeah. Okay, likelihood ratio. Oh my goodness, this is not a good one. Okay, likelihood ratio. Oops.
a group of like sorry, a group of researchers invest a group of researchers investigate the potential of pleiotropic growth factor mid kind as a marker of thyroid cancer. A total of 500 groups of thyroid cancer and 800 patients with no history of thyroid cancer were included in the study, and their serum midkine levels were measured. The data analysis included the data analysis included a stratified analysis based on midkine levels. An excerpt of the results is shown below. The researchers wants to report the positive likelihood ratio association with the serum midkind level more than 350 uh, zero point 0.5 picogram per ml. Which of the following is the closest value the researchers should report? Likelihood ratio positive is sensitivity divided by 1 minus specificity, isn't
Okay.
it?
Okay. Mm-hmm.
Am I right?
Yeah. 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 You're right.
So we need to find out the sensitivity and specificity.
Okay. So what do you? I'm gonna write what you're saying. So what do you think the sensitivity will be?
Sensitivity. So how we can find out this sensitivity from this table?
Mm, I don't know.
There
Sensitivity is usually people that test positive for the disease over all the people with the disease, right? Or not? Am I wrong
are you talking
about
about the relative risk or that thing?
that? Is it relatively okay? Then I'm wrong. Okay, how do you be wrong? Okay, how you find it?
Sensitivity is true positive divided by true positive plus false like false negative, isn't it?
Okay, so do you want to make the two by two table? I can make it for you.
Yes.
Okay,
Apart
let's
from
make it.
2 by 2 table, eye disease versus test.
The disease will be
Positive,
disease is the
negative.
one on top, right? And
Yes.
test one on okay. So here will be true positive. So what do I put here?
True
What do you want
positive.
me to put?
Disease is positive and test is positive. That is true positive.
Okay, what number do you want me to put here?
What number?
Oh, you
That
don't want me to put a number here? Yeah.
I am
What
looking
number?
for number more than 320. So this number 375 would be. They are number of patient with thyroid cancer 375.
375. Okay, you want me to put three? Okay, I'll put 375. Okay, what do you want me to put for true negative? Or you tell me. You can see my screen, so you tell me what you want me to put in the other ones.
Total 500 patient with a thyroid cancer, isn't it? So 375 is here. So 500 minus 375. So how many? 500 minus 375, 5 and 3 is 135.
135. Oh, you want me to calculate? Let me get my phone.
Okay, or 235, 235.
Say 500 minus 375. Yeah, it's 125. Okay.
Is it
Okay.
125 or 135?
125.
Okay,
500 minus
okay,
375.
125. Yes,
Uh-huh.
125.
Okay.
Okay. So, and the specificity, look at the specificity. One to,
Mm-hmm.
in here 120, like in the true negative, the number of the patient with no thyroid cancer.
Mm-hmm.
Put 120 here, yes,
120 here in true
yes,
negative.
yes.
Uh-huh.
And the upper one is 800 minus 120.
300 minus 120, that will be, let me calculate it. 800
Zero,
minus 120, that will be 680.
yes, 680.
680. So your sensitivity will be what? What do you want me to put?
Sensitivity goes down, so 375 divided
75
by 500.
by 500.
And specificity is
Mm-hmm.
1 minus 120 by 800.
120 by 800.
So now calculate.
Okay. So sensitivity will give me 375 over 500, 0.75, and specificity will give me, I wish I had a better thing, 120 over 800. That would be 0.15.
Yes,
And you
1 minus
and then you said that the likelihood ratio, positive likelihood ratio, you say was sensitivity, so 0.75 over what?
0.85.
0.85. Wait, I thought it was one minus specificity.
Yes, do 1 minus
Point.
specificity.
Okay, so it's 0.85. So what's the answer? Okay, let me see.
It does
Whoops.
not match
Point
your
seven,
actual answer.
point 85 is 0.88.
It should be, but they give the answer 5.
Oh, there's something we did wrong, I guess. Let's see how they found theirs. Hmm. Okay, read the explanation.
Okay, look at the 2 by 2 table first. The red
Okay,
one
which one?
below. Yeah,
That
this
one.
one.
Okay.
So
Mm-hmm.
how we have done the 2 by 2 table?
We did this one. 375. You got that one.
Yes,
125 on by the bottom. We got that one. And total 500. So we got this one. And then sensitivity is 375 over 500. We got this
yes.
0.75. And then on the other side,
With no thyroid cancer.
okay, with no thyroid cancer, we got the, but it's a different way. We got 680 and 120, but we put our 680 on top and the 120 at the
Like
bottom.
according to it comes, if you think that true negative, that means no cancer. No cancer is for 120 people, isn't it? If we do 2 by 2 table.
Yeah, yeah, but true negative, yeah, will be, wait, true negative, yeah,
I-
120.
Isn't it? I don't think that we are wrong, and we have to subtract the total number of people without thyroid cancer.
Without thyroid cancer. Okay, okay.
So
So they got
120,
0.85 here for their
we have found the point
specificity.
85 also.
No, mm, kind of. But we found it when we did -1. They found it on the specificity,
Yes,
right?
that's
Or
yes.
am I wrong? Yeah. Okay, read
Read from here. Okay.
from here. Yeah.
In this case, the researcher in this case the researchers evaluate the diagnostic performance of the pleiotropic growth factor midkine as a marker of thyroid cancer. The study include 500 patients with thyroid cancer and 800 without thyroid cancer. The researcher want to report likelihood ratio associated with the serum midkine level more than 320 milligram 320 picogram per ml. In patients with thyroid cancer, 375 of the 500 patients, the probability of the testing value is 375 by 500 is 0.775%. This means the sensitivity of the midkind at the cutoff is 0.75 and 75%. In patients without thyroid cancer, 120 out of 800 patients. The probability of the testing positive is 120 by 800 is 0.15, 15%. 15% 120. Okay. This also means the specificity of the midkind is the specificity of the midkind is at the point 1 minus 0.1585%. This value can also be obtained by considering 680 800 minus 120 of the 800 patient without thyroid cancer tested negative based on the cutoff 600 divided by 800, 680 divided by 800 equal to 0.85. Choice D. Can you make me understand the second para?
Mm, I think the answer is actually,
What we have done?
I think the answer is what we have done because it says choice D, and our answer is 0.88, which is closer to, yeah, to this one.
8.85. I think that
Yeah,
5 is not the answer. We have
I
done
think
right.
5. And you see that this was written and by somebody. It's not part of the, So I think
Yes.
the person, yeah. Because here you say it is choice. It's telling you it's choice D. So
So
I
how
think
how I think that we
so.
have calculated right, isn't it?
You're right. That's you that based on the what you just read is telling us that I'm understanding that we calculated it the right way. They are
Yes.
doing the same thing, 120 over 800.15, and then they took the one out, what gives the like the 0.85, and then they did this. So it's kind of like, okay, keep reading, keep reading.
Yes.
Right. Mhm.
Okay. Based on the calculation, the researchers should report that likelihood ratio is 0.75 divided by 0.15. Based on the likelihood ratio, 0.75 divided by 0.15 is the 5. That is the
Mm, no, the answer is 5. I still don't get it.
me too.
Okay, this is this part. The first part we got it right, the sensitivity. Is the specificity part that we are not getting. Patients without thyroid cancer, 120 out of 800. We got that part. Had serum creatinine more than 320. We got it. Therefore, the probability of a patient without thyroid cancer testing positive based on that cutoff is 120 over 800. 120 over 800. So that's the specificity. 0.15. Got it. This also means that specificity is probability of testing negative in absence of disease of the mean kinine test at that cutoff is 1 minus 0.15. This is where we are getting, this is where we're getting, yeah, it's an issue.
According to according to equation 1 minus, I don't know why how they found. Okay. Oh,
Oh, you got it?
yes. They have gone through this formula.
What formula?
Wait, I'm make made you.
You sharing the screen?
Yes. Wait 1 second. I
Okay.
have to find first. What have I found? Okay. Okay. They have used this formula. Can you
Hmm.
see?
Not yet. Not yet. Okay, now. Which formula?
One minus. Are they are using this thing specifically one minus false positive? This one.
Okay.
If you we have done
Okay.
through this thing, isn't it?
Okay.
L-
Mm-hmm.
So so are they are using this thing one minus false positive? Because other than that, it does not make sense. I haven't found anything.
So one minus false positive will give you the specificity. Is that what you're saying?
Yes,
Okay. Okay. Our false positive was false positive was 125.
120. Okay, no,
Wait. Yeah, that was a
no, no.
false.
That will not gonna solve this. I don't
Mm.
know that that part is the problematic. The rest of the is normal.
Um, I'm gonna ask my tutor after. I'm gonna text him that. But yeah, we have to this. I don't understand that part.
Okay,
Okay. Let's
let's
keep
leave
going.
this question and
Let's leave question. Next.
okay. Confidence interval. Sorry, confidence level. Confidence level is going down. Okay. Confidence level. The National Health and Nutritional Examination Survey. National Health and Nutritional Examination Survey conducted 2017-18 estimated that the mean amount, the total sugars consumed per day by adult age more than 20 is 107 gram with a 95% confidence interval of 104 to 110 gram. If the confidence level is increased to 99%, which of the following are the most likely lower in the upper confidence level limit? 99%. 95 হলো 104 120 per
What do you think it is? I don't know if the answer is coming, but I don't want to go down. Okay. Which one do you think it is?
68 95 99. See, where is the the difference?
I don't understand your question.
107 gram is 95 and confidence interval is 104 to 110 to 3 and 9 107. Okay. Hmm, ষোলো। Wait 1 second. I can do
No,
it.
it's okay. Take your time. It's okay.
Is it option 2?
You mean this one?
B.
Like,
Yes, yes.
I think it's this one, but let's check. I don't know why they didn't put letters on here. I think it's one, but let's check. Oh, you're right. It's B. Mm, that's weird. Okay, okay.
Okay, let's see.
Let's read.
A confidence interval is the range of a plausible values calculated from sample data that capture the population value population mean with confidence level. The confidence level C refers how often confidence interval the true population value if the calculation process is repeated multiple times. A confidence interval to estimate the population value population mean is constructed by adding and subtracting the margins of error based on the desired confidence level from the sample value sample using sample mean. Therefore, the sample value is always the midpoint of the interval. The confidence level is equivalent to 1 minus alpha, where alpha is the significance level for confidence interval. Conversely, the significance level alpha 1 minus confidence level for a percentage of confidence interval. For example, 95% confidence interval has 95% confidence interval and 100% 100 minus 95 5% significance. It captures the central 95% of the distribution. A 99% confidence interval is 100 minus 99 1% significance level. It captures the central 99% of the distribution. Therefore, for the same data, a confidence interval greater confidence level is always wider than the confidence interval with lower confidence level. In this question, National Survey estimated that mean amount of total sugars are consumed per day by adult age more than 20 and 107 sample mean with a 95% confidence interval 104 to 110, increasing the confidence interval 95 to 99 for the same data results in a different midpoint. Sample mean is 107, but it is wider than 95% confidence interval. Therefore, the most likely lower and the upper point is 102 to 112. They haven't said anything.
They haven't said it.
That thing I
Some of these things
calculate
come to-
like
Uh-huh.
uh, if you simplify in that way,
Mm-hmm.
you know the 107. We need the upper level and the lower level, isn't
Mm-hmm.
it?
Mm-hmm.
So we need to find out the difference. If you look
Mm-hmm.
at the first difference, 104, so like look at the question,
Mm-hmm.
104 to 110, isn't it? The middle is 107.
Okay.
So
Mm-hmm.
there is 3. The main
Mm-hmm.
thing is 3. So
Mm-hmm.
for 3 9 68 95 99 rule, isn't it? So
Mm-hmm.
99 is 3 into 3, that means 9. So if you find anything there is difference 9, so it may be the answer. So in here it is not approximately 9, it is approximately 10, but closer to 9. You got my point. So how
Okay.
that's how I find out. Is it
Okay.
is it difficult?
It. No, 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 no.
Like my way is to find out the narrowest way in the whole world.
Yeah, you got it. Yeah, yeah. I mean, it makes if it makes sense, and
Because
you got the
other thing like they how they explain, I don't get anything. I don't understand how they
yeah.
explain this. Like
So you got the main.
I know the three rule, like a 68, 95, 99 rule. So 99 is three, like that means you have to find out the difference first and multiply into three. Then you can got the upper and the lower confidence limit. That's how I calculate.
Okay, okay. Wider.
How you think?
No, it's what the way I thought. I forgot that. I think my tutor has told me that this number, the 107, always have to be the middle number.
Yes,
So
it
that
has to
already,
be my real number.
yeah.
Yes, true.
So that already eliminates what this one. The A definitely eliminates that. It eliminates the C and eliminates the thing because in those ones, 107 is not. Oh, it's not the middle. Sorry, it's not in the middle. You see it right on those ones.
Okay,
Does it make sense or not? Okay, because like look at this, like 102 to 107 is 102 minus 107 is 5 points. Okay, so five, and then 107 to 108 is 1 point. So 107 is not in the middle.
okay.
Okay, same thing here. 107 to 104.
So
7
it is in
minus
the
1
middle.
is 3.
Three, then
Uh,
it is three.
okay, let's remove that one. That one is good. That one is
That
an
one is
option.
given in the question paper
Is
also.
an option. And then 107, this one is in the middle too. But this one, 106 to 10 whatever,
No,
this
it
one is
is
not in.
not in the middle. Yes.
So we can remove those two.
Okay.
Now the
Then
issue that I had was that so if we increase the confidence interval from 95 to 90, sorry, the confidence level from 95% to 99%, that means we are more confident about the results. I'm thinking that's what they mean.
yes,
So if we are more confident about the results, then the confidence interval here, the 104, does it get tighter, so closer together, or does it get wider, so farther apart? That was kind of my question. Because the one
according
that
to
you,
this, according to
mhm,
the answer, it is wider, isn't it?
gets wider, you see? That's
Okay.
where I was confused. I don't know if it got wider because then if it gets in my mind, it makes sense that if you are more confident than then the interval will get smaller. That's I don't know. That's what it makes in my mind, but it seems like it's not that. It actually gets wider. I think that's what they're trying to explain in this whole. Okay, let's look at the educational objective. A wider confidence interval with a greater confidence level is always wider than a confidence interval with a lower confidence level for the same results.
What does
Does
it
it make
mean?
it's what I just said. Like I was confused. I didn't know if you the confidence level increases from 95 to 90, 95 to 99. That means you are more sure of your results, right? You are more
Yes,
confident.
yes,
So I will assume that that means that the confidence interval will get smaller, will get tighter. That's what I thought.
yes.
But they are
But
saying here that no, it's not like that. The confidence interval will get wider too, will get wider. It wouldn't get tighter, smaller. It will get bigger.
okay.
Okay, I think that's what they're trying to say. So that's I guess that's the
Like
key to keep it.
we can think in that way. Like if you throw a big net, and if like
Mm-hmm,
we both are going for fishing. If I
mm-hmm,
throw
mm-hmm.
a small net and if you throw a big net, there is a possibility of getting chance of fish by you than the me, isn't it?
Okay, say it again.
Like you throw a big net and I throw a small net. So as you throw a big net, you are more confident that you will get the fish, and I am not
Okay.
that confident that I will get the fish, because the
So,
more the wider, like if you throw a net which covers the whole pond, then you have the
mm,
possibility, 99% possibility of getting a
mhm,
fish, isn't it?
mm. I
So
get.
your
I like.
your confidence interval is wider,
I
and you,
like that.
uh, I am assuming like a literature. Don't take it as for example.
I like how you explain. No, it makes sense. I like how you explain it. Yeah, because my confidence. Yeah, because I my confidence level will be higher than yours, and
Yes,
my confidence level will also be bigger because I have a bigger net.
yes. The
Yeah,
only thing the after reading that line, I that things only comes in my mind.
I like it. I like it. Yep.
Okay,
Let's keep that. I'll keep it like that. Yeah, I'll keep it with that explanation.
okay.
Okay. Summary.
We need to simplify everything.
Yeah. Yeah.
Okay. Summary: more precise, low confidence interval. Sample size increase, power increase. Sample size increase, power increase. Uh, Confidence interval decrease. Sample size increase or decrease. Sample size
Sample size.
increase, confidence in sample size decrease, confidence interval increase, isn't it?
Wait, where are you reading?
The third line,
Uh huh.
i-
Uh huh.
if the second line says that sample size increase and confidence
Hmm.
interval decrease, now the sample size decrease, that means the confidence interval increase, isn't it?
Yes. Yes. Mm-hmm.
And the confidence interval increase, and I don't know the last one. Both of them are increase. What does it mean?
It's what you just said with the net.
Okay,
Like I have my confidence is 99. Your confidence level is 90 whatever 5. So my and then I throw the bigger net. I have 99, I throw the bigger net, you have 95, you throw the small net. My interval will be bigger. I'll catch more fish because I have a bigger net. Your interval uh, will be like smaller because you have a smaller net.
okay,
So basically, both of them go together. High confidence, high level, low
okay,
confidence, low level. Okay, I guess that's the key. Remember, high level, high interval too.
okay.
And then last one,
Very hard to remember
it's
those.
hard to yes, yes, yes. But you see how they played in the question. So it's but if you as soon as you just know that the both of them go together, then that question would have been easy. Like you just know 107 needs to be in the middle, and then the confidence interval needs to increase. So you could get this in like seconds. But you need to know those summary, those key points. So it's yeah.
Okay,
Okay, keep
so
going.
the last one,
Oh,
standard deviation. What does AC means? I actually
oh,
forgot.
standard of error. I think error.
Yes,
Uh-huh.
standard of error divided by standard deviation. Was what does the SD
Oh,
stand for?
standard deviation.
Okay, standards of error equal to standard deviation divided by n. If n
Mhm.
increases, then standard error, if n increases, standard error decreases. The confidence interval narrows, but standard deviation remains the same.
Does it
Oh,
make sense?
yes.
Okay, perfect.
Okay, next.
Mhm.
You want to go for your breakfast or we can carry?
Up to you. I don't.
No, no,
I'm
I
not.
don't have any problem because I am learning.
You know. I know. I feel like we're going to finish this thing before. Okay, let's keep going. I feel like we're going to finish this part.
Okay.
Let's
A group of pediatric oncologists conducts a study in which exposure to radiation from CT scan is compared between children with a diagnosis of leukemia at age less than 15 and children age and sex matched without the diagnosis of the leukemia. Information is also obtained on birth weight, maternal smoking, parental socioeconomic status, background gamma radiation. Data on CT scan are collected from medical records in two university hospitals. Which of the following is the most appropriate measurement of association for this study? What is this? Is it hazard ratio?
Which one do you think? You think it's hazard ratio?
Yes, information is obtained on. I don't know actually.
Okay. They're asking for the measure of association for so what do you need to find first before you find what measure of association? If
There are lots of hazard like maternal smoking, uh, pat paternal socioeconomic background, gamma radiation. Isn't it hazard? This is not odds and relative risk, isn't it? I don't
what do
think
you
so.
okay, like look at the question. The question is asking you which of the following is the most appropriate measure of association for this study. So which of the so basically they're asking you is it odds ratio, is it prevalence, or is it relative risk? So what do you think you need to find first in order to find if it's odds ratio or relative risk or prevalence? Shouldn't you find first what kind of study it is? If it's cohort, if it's
Yes,
case control. Yeah, because if you find it, then you if you already know it's case control, then you know it's all. If you know it's cohort, then you already know it's relative risk.
yes.
So, what kind of study do you think it is they're using here?
I think that is cohort.
Okay, so if it's cohort, do you
Cohort
what
is
would you,
relative risk.
oh,
Is it
okay you would
cohort?
okay, so you think it's cohort? I think it's case control.
Why is that?
Let's let's think about it. Let's go back to our diagram. Are they grouping the things? The Are they randomizely grouping the patients?
No.
Yes or no? No. So we know it's not RCT. Fine.
Yeah.
Let's go up. Let's go up. Are they doing it? Are they selecting the patient based on exposure?
Exposure. Yes.
Okay, so you think they are selecting the patient based on exposure, based on if they are exposed to CT to radiation or if they are not. You think that's
Yes.
how they're selecting the patient. Okay, I think they're selecting the patient based
Outcome.
on outcome because they are giving you children with leukemia and children without leukemia. That's what I thought.
Disease
So okay, but
versus
then
non-disease.
the disease versus non-disease. That's what
So
I thought it was. So,
okay.
but
So yes, it's case control. Now I picked up.
no, don't go with me. I'm not sure.
No, no.
I'm
Now
just
now I am
listening.
confirmed.
I'm just trying to help you to go to the. It helps when you go to that log algorithm thing because you yeah. Okay, let's look at the answer and then you check. Okay, it's odds ratio, so we know it's case control. So now go ahead, read the explanation.
So in here we have gone through the outcome like leukemia and without leukemia and
Yeah, because
yes,
if if it was what you said cohort, they would have give you radiation. exposure to radiation and not exposure to radiation. But if you, when I'm looking at the question, it's just telling you children that were exposed to CT scan. There is nowhere where they are saying children that were not exposed to CT scan. Nowhere in the question.
Yes.
So yeah, so they, it cannot be selected by exposure and no exposure because they only tell talking about the children that were exposed. But for the outcome, leukemia, they're telling you leukemia, blah blah blah. Children that had leukemia are less than 15 years old, and children that didn't have leukemia. So they are giving you outcome and no outcome. That's kind of how I looked at it. Does it make a little
Yes,
bit of
it
sense?
makes sense.
Okay. Now let's read
Okay.
the answer. Mhm.
And this case describes a case control study in which participants are initially selected based on their disease status cases, diagnosis of leukemia or control, no diagnosis of the leukemia. Once participants are categorized based on disease status, the status to post exposure to a risk factor of interest and is determined in each group because cases by definition have because cases by definition already have the disease. Case control studies cannot calculate and compare incidence. Instead, the odds of exposure are compared between the cases and the controls. Therefore, a common measure of association connection between the exposure to a risk factor and disease occurrence in case of case control studies is the odds ratio, calculated as follows: odds ratio, odds of the exposure in cases divided by odds of the exposure in control. The odds ratio is sometimes described as the odds of the disease among exposed patients relative to non-exposed patients. These two OR definitions are mathematically equivalent. Measures of association based on risk or incidence relative risk are calculated in cohort studies and experimental design in which participants are initially selected based on exposure status, exposed or non-exposed to a risk factor or treatment, and then followed over time to assess the development of the disease.
Makes sense.
Yes,
Okay. Can you read hazard ratio and whatever that I want to see what they are.
okay. Hazard ratio and the mean survival are commonly used in cohort studies and experimental designs to compare total and median survival times respectively in two or more than two patients, those exposed to a risk factor and those non-exposed to a risk factor, or those receiving a new treatment and those receiving a placebo. What does it mean?
Don't know. Don't know. I don't know.
How people do biostats.
Oh my goodness. I think it helps when you find the question. Okay, it says
All the biostatisticians are crazy
yeah, that it must be like you really like it because there is no way.
because there is no way of matching this type of
Yeah.
things.
Oh my God. Okay, it says hazard ratio compares the total survival time in two groups of patients. And hazard ratio, I guess, is used in, it says cohort. Uh, anyway, basically, hazard ratio is median survival time, and then oh wait, no. No, don't. Let me not confuse you. Let's leave it like that. Let's leave it. Oh wait, no, he says hazard ratio is the total survival time, and median survival time is the median survival time. So they are just the survival times. Hazard ratio is the total survival time, and median one is the median survival times. And they are using the cohort and experimental groups. Let's just leave it at that. Okay. Next, the red thingy.
Whenever selection whenever selection is on the basis of
Don't
disease
make fun of
versus.
me, Omar. Like, don't make fun of me. I'm trying.
No, no,
Like,
I am not making fun of you. Truly, trust me. You sometimes you say it like that. Read the red thingy. That's why I laughed.
oh, okay.
Not because not you are trying your best, and I know that. I know it. You are trying your level best, and I know you are far better than me in case of
No,
biostat
no,
in
I told you,
every
right?
aspect, but
I
in
told you
biostat
that I
too.
went to, I
Yes.
told you that I went to my step one and I didn't touch any biostats. I
No,
was
no,
just, I
that's
gave you,
that's not a problem.
yeah,
I
yeah,
laughed.
like,
I laughed. What? However, you just say it like the red thingy.
oh, the red
That's
thingy. Okay.
that's why I laugh. Okay. Whenever selection is on the basis of diseased versus non-disease, it is case control. Okay, that one, the disease versus non-disease. Okay,
Okay. Next.
okay.
Oops.
A recently published article, a recently a recently published article reported on 80% reduction in the subsequent anterior shoulder dislocation in young athletes after they underwent a new surgical intervention. A total 80 athletes, all whom had a history of anterior shoulder dislocation, were randomly assigned to either undergo a new surgical intervention or receive an exercise-based conversation intervention, convert conservative intervention. The incidence of subsequent anterior shoulder dislocation was 4% among those who underwent surgical intervention and 20% among those who received conservative intervention. Which of the following was most likely presented as 80% reduction in the incidence of anterior shoulder dislocation? Are they talking about relative risk reduction?
Mm-hmm. How did you find it?
80% reduction in the incidence request. This thing.
Oh,
Am I
oh.
am I on right track or
You are, I mean, you got the right answer, but I just don't know how you found it so fast. So, but if you, I mean, if you got it, you got it, yeah. If that makes sense to you, then yeah. Yeah. Okay. Let's
okay,
read the
let's see.
answer.
Okay, relative risk reduction. Control is conservation intervention, surgical intervention is the treatment group. ARR absolute risk reduction 20 minus 4 16. Control is 20. So relative risk reduction is 80%. The study in compared the incidence of subsequent anterior shoulder dislocation in two groups: young athletes with a history of anterior shoulder dislocation. One group underwent a new surgical intervention, and the other group received exercise based on conservative intervention control group. The incidence rate of subsequent anterior shoulder dislocation is as follows: surgical intervention group is 4%, conservative intervention is 20%. Indicate absolute risk reduction, control minus intervention rate. is the subsequent entry shoulder dislocation 0.20 minus 0.04 equal to 0.16 or 16%.
No, okay. So we know A is not the answer.
Okay.
You get it from you get it all the way here, right?
Yes.
Okay, perfect. It's fine.
In addition, the relative risk reduction, the relative risk, absolute risk reduction divided by control rate. Absolute risk reduction
Mm.
is 0.16 and control is 0.20, 0.80, 80%.
Oh, okay.
This means the new surgical intervention offers 80% reduction. So they actually calculate the relative risk reduction.
Yeah, they use
Eh?
the ARR to get
Yes,
the. I didn't know that formula.
yes.
Let me write
I
that down.
I found it like a guess.
Oh, like it.
What you thought? I calculated.
I I thought you can. I mean, I didn't know, so that's why I asked. Because I was like, how did you find it so quick? I went, but I was like, maybe you have a, hey, if it makes sense, hey,
Sometimes
do it.
I listen to my mind and give the answer. Most of
Yeah, if
them
it
are
makes
wrong.
sense, if
Sorry?
it makes sense, then yeah, do it. If it makes sense to you and you get to the right answer, yes, do it.
Yes.
Okay,
Okay.
keep going.
Drug advertisements sometimes prefer to report relative risk reduction rather than absolute risk reduction because relative risk reduction often provides larger, more impressive values. ARR is 16% and relative risk reduction is 80%. The relative risk reduction can also be calculated on the based on relative risk. The relative risk for subsequent anterior-shoulder dislocation in athletes who underwent new surgical intervention compared with those who received the conservative intervention is calculated as relative risk divided by relative risk equal to intervention rate divided by control rate 0.40 divided by 0.20 equal to 0.20. Relative risk 0.20 indicates the athletes who underwent the new surgical intervention only 20% are likely to have anterior shoulder dislocation of athletes as athletes who receive the conservative intervention. Relative risk can be used to calculate a relative risk reduction 1 minus RR 1 minus 0.20 0.80. Okay.
Okay, that one, everything makes sense stuff all the
Yes.
way here. Okay, can you read B?
Yes.
Just, mhm.
The number of the athletes with a history of anterior shoulder dislocation who have to undergo the new surgical intervention to avoid a subsequent anterior shoulder dislocation is determined using the calculation for number needed to treat in this study with an absolute risk reduction with an absolute risk reduction of 0.16 number needed to treat 1 minus absolute risk reduction 1 by 0.16 equal approximately 7.
Perfect. Okay,
Okay,
next.
yes. Next, okay, measures of association. Mm, should we go straight to the equation or should we read this first? Okay, this,
Oh, mhm.
okay,
This
risk,
is on the videos. This
this,
whole thing comes from the
yes, I
videos.
have seen this video today.
Mhm. Oh, you've seen it. Okay, then we don't need to read it that
Okay,
one because you
then
you
we jump
you
to the
got it.
question.
You got
Yes,
it from the video, right? Okay, okay. Then we don't need. Wait. Then let's do this question.
okay, relative risk and odds ratio. Okay, A cohort study is performed to investigate the effect of smoking on our risk of myocardial infarction patients divided into two groups based on the smoking status followed for 10 years to determine occurrence of the myocardial infarction with the results produced on the left. What is the relative risk? Relative risk reduction ratio, relative risk reduction, and odds ratio of MI comparing to smoker versus non-smoker. Smoker versus non-smoker. Case cost. Okay.
Okay, you tell me. I'm gonna write it on my board. You tell me what
Okay. For odds ratio,
odds
smoking,
ratio.
yes, smoking 500 divided by 1500
500 divided by 1500. Uh-huh.
over,
1500 over
yes, over 1000 divided by 9000.
1000 divided by 9000. Okay.
So 1 by 3 into 9 by 1.
So
So
the top
3.
will be the top will be 500, 1500 will be 0.33.
On just 3.
3.
Yes, 1 by 3. Do it simplified 1 by 3 divided by 1 by 9.
Okay, so the whole answer you say is 3?
3, yes.
Okay, perfect. Okay, so we are done with odds ratio, right?
Yes.
Okay, relative risk.
500 divided by 2000 over 1000 divided by 10,000. 1
1000.
by 4, 10, 1 by 4 into 10 by 1, 2, 5. So it is 5 by 2, like 2.5, 5 divided by 2.
Okay,
How
so the final answer is what, 2.5? That's what you're telling me?
I'm thinking.
Oh,
5 divided by 2.2. What? 5 divided by 2. Yes, 2.5. Sorry. Yes.
2.5. Okay. And then the relative risk reduction, what would
Is
it
it
be?
1 minus or 2.5 minus 1?
Well, you said the relative risk was 2.5, right? Not 2.55. It was 2.5, you said.
Yes, 2.5 minus 1 equal to 1.5.
Okay. Okay, and then you said relative risk reduction will be
1.5.
1.5.
And
Okay.
negative will not gonna consider, isn't it? So I think that 2.5 should be in front and 1 should be. You got my
Okay.
point, what I'm trying to say.
Okay, so you're trying to do 2.5 minus 1,
1, yes.
okay, which is 1.5. Okay. Okay, let's look at the answers. Okay, relative risk, you got it right 2.5. Odds ratio, you got it right 3.
So
But we got
we are wrong about relative risk reduction.
relative risk reduction. They did 1 minus, where they
How
got the
this
final.
how this point 1?
Mm, I think they did the risk on the unexposed over risk on the exposed. I remember that question. Because relative risk is risk in, you see, risk in the exposed over risk in the unexposed.
Yes.
But that gives you 2.5. And
Yes.
that's why you were saying that 2.5, you cannot subtract 1 minus 2.5 because it gives you a negative number, right?
Yes.
Yeah. So what they did, instead of doing risk in the exposed over risk in the, so they switch it. They did risk on the unexposed over risk on the exposed. So it will be, you see, zero point 0.1 over
Point.
0.25.
Okay.
Yeah, and that will give you zero point 0.4 instead of 2.5, and that's zero point 0.6. He explained it. I remember that if you look at the video, you will see how he explains it. He's like, because here the yeah, he explains it on the video. Basically, if he gives you a negative number, go switch the risk thingy. But he explains it better. You have to look at the video. He explains it there. But at least you get the idea because you got all the other things right. So that's good. That's good.
Okay.
Okay, with this one, let me know what I need to write.
Number needed to treat. Number needed to harm.
Yep.
Okay. Number needed to treat. Equal
Mm-hmm.
equal to 1 by absolute risk reduction, isn't it?
Mm-hmm.
Absolute risk reduction is risk exposed minus unexposed. Oh,
Mm-hmm.
sorry. Mm, the risk, like patient who are getting drugs or no drug. Okay, 15 by 85 minus 100 by 400.
15 by 85 minus 100 by 400. Okay.
So,
So that will
what is the
give you,
answer?
let me calculate it in my calculator. You know what?
Am I in the right track?
Let me see, I don't remember. I just saw this. Risky. I just did that. Wait, you say it was risk in the exposed minus risk. No, risk in the unexposed of minus risk in the exposed. So we need to find the risk in the unexposed is what you're saying is 15 over 85. Risk in the unexposed. So it will be here. So it will be this unexposed over total number of people in that thing. No, I don't. This. I think that you. No, 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 no.
We need to calculate the whole. 15 divided by 100.
Wait, where did you get the 15 and the? Oh, you got it from the top. Okay,
Yeah,
no, no, no.
yes.
Okay, okay. Remember, attributable risk is risk in the unexposed first. So you have to look at the unexposed. So that will be this line.
The negative one, like 100 by,
So it will be 100. I think it will be 100 over
uh,
500. I think. What do you think?
maybe.
Because look at here on top. It says the risk amount unexposed is the number of people
Okay, yes, yes, you are right.
in the unexposed group that have the disease and the yeah. So
So in here,
let me write this.
15 divided by 100, like 0.15, and
Okay,
100
maybe
divided by 400, 0.25. So 0.25 minus 0.15. 0.25 minus 0.15.
wait.
Point
Can you?
1.
I'm going to write it. Give it to me again. So
Yes,
ARR would be what?
ARR is like 100 divided by
Mm-hmm.
500
Mm-hmm.
minus 15
Mm-hmm.
divided by 100.
Minus 15 divided by 100. Okay.
Okay, so 100 divided by 500 is zero point 0.2, and 15 divided by 100 is 0.15. 0.15. So zero point 0.2 minus 0.05.
0.2 minus 0.05. Uh-huh.
So 1 by 0.05 equal to 20.
So this is 20. ARR you say is
Yes,
20%.
yes.
Okay. So the negative net, sorry, number needed to treat will be what? 1 over 20? Is that what you're saying? I'm writing what you're saying, so tell me.
No, 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 no.
Mm-mm.
Point 2, wait. Point
Okay.
2 minus 0.15. Point 2 is right.
Okay, you want me
I-
to delete this one?
Yes, this one.
Okay, so here I should write what?
0.15.
0.15.
15
Uh-huh.
divided by 100 is 0.15. So
Okay.
subtract it. It would be 0.05.
It will be 0.05. 0.05. Okay. So the number needed to treat will be E.
1 divided by 0.05.
Mm-hmm. Which will be
20.
okay, perfect. Now number needed to harm.
Okay. Number needed to harm, I think that it is opposite.
Mm-hmm.
Like in here 50 by 100, 50 by
What are you calculating?
the diarrhea one below.
What is the formula for number needed to harm?
The same as the number needed to harm.
So 1
1
over AR,
AR, 1 over AR, yes.
1 over AR. Okay, so you're trying to calculate AR first.
AR first, yes.
Okay, so AR will be
AR will be 50 by 100
50 by 100. Uh-huh.
minus 200 by 500.
200 by 500. Okay.
50 by 100 is zero point 0.5
Mm-hmm.
and 200 by 500 is zero point 0.4. So zero point 0.5 minus zero point 0.4
Mm-hmm.
equal to zero
Which will
point
be
0.1.
mm-hmm.
So 1 divided by zero point 0.1,
Mm-hmm.
it is 10.
Okay.
Are we in the right track?
Okay, let's
Oh,
look at the answer. You said 10. I'm trying to write this. Okay, let's look together. They got the whatever ARR. They got zero point zero 0.05. We got zero point zero 0.05. Good. And NNT, sorry, they got 20. We got 20. Good. We can also check because you also did the risk in the exposed. They got 0.15. You got 0.15 right here. Perfect. And the risk in the unexposed, they got zero point 0.2. You got zero point 0.2. Perfect. You got that one. And then number needed to harm, AR, they got zero point 0.1. You got zero point 0.1. Good. And NNH, they got 10. You got 10. You got it. Next.
okay. Okay. Now the internal and external validity and the biases. Okay. Internal validity, confidence in the accuracy or truth of the results are that were obtained in the present study. Traits of the internal validity is selection bias, sample under study not representative of true population of the interest. Example, volunteer bias, attrition bias, measurement bias, inaccurate measurement of the factors, exposure outcome confounding variables leads to inaccurate analysis. Examples, observer bias, recall bias, confounding third variable association with exposure and the outcome but not along the causal pathway leads to apparent association. Confounder exposure and the outcome smoking, lighters, and the lung carcinoma. Smoking is the confounder, exposure, and the outcomes. Okay. External validity is the generalizability ability to apply the study findings to a wide variety of the population. Key idea results can have internal validity accurate for study population but lacks of external validity not the applicable to other population. Threats to external validity are special population. Example study of the physician and single care analysis. Special or limited treatment availability. CAR T cell therapy, molecular imaging. Okay, can you
Everything
add
makes sense?
something?
No? Does
Okay,
everything make sense?
yes, it makes sense.
Perfect. Next.
Selection bias and the measurement bias, type of biases. Selection bias is voluntary bias. Study includes individuals who volunteered to participate, patients who volunteered to participate in medical studies may not represent the study population. Higher risk for condition under study, increased health literacy, attrition bias. Patient lost to follow-up differ from general study population, increased medical morbidity, lower health literacy. Bergson bias. Patients drawn from the hospitalized setting who may not represent general study population. How to overcome randomization with intention to treat analysis clearly defined population. Measurement bias is observer bias, recall bias, outcome bias. Observer bias is systematic bias in measurement due to researchers' expectation or prejudice. Patient receiving active therapy have better outcome. Recall bias study participants asked to provide information on present events but do not accurately remember details or omit information. Hawthorne effect study participants act differently because they know they are being observed. Better adherence to healthy lifestyle choices. How to overcome blinding of patients. Researchers and analyze triple blind validated measurement tools. Way to manage confounding include matching, selecting controls that are similar to cases across the multiple domains, randomization, theoretically disturbing confounders, equally between the groups, restriction only, including cases and control to the specific value in one domain non-smoker. Okay,
Everything makes sense?
yes.
Okay. Question.
A randomization. A randomized placebo-controlled trial is conducted to compare the effectiveness of a new drug versus placebo for the treatment of hallucinations and delusion association with Parkinson's disease. A total 60 patients diagnosed with severe PD psychosis and are PD psychosis are randomly assigned to receive either the new drug N30 and placebo. In new drug N30 placebo N30, the primary outcome is the change of PD adapted scale for assessment of positive symptoms. A group of independent and blinded raters administered of SAPS PD to measure the frequency and severity of hallucination and delusion of all participants at baseline and week 6. The results of the study showed that The new drug is significantly more effective in reducing the frequency and the severity of hallucination and delusion. P-value 0.01 compared to unblind trial. Which of the following is the effect of include which of the following is the effect of including a group of independent blinded treaters in this trial? What is the answer?
What do you think? I'm waiting on you.
Oh, sorry.
Just I want you to give me the answer before.
I don't know actually.
Okay,
Is it
okay, let's
is it increase internal validity?
why? You just read and you say you understood everything that you read. So why is it that
Let me explain. Sorry,
okay?
explain,
Yeah,
explain.
yeah.
You explain.
Mhm.
I
No,
don't.
you explain.
No, no, I
How
can't.
so how did you come up with increased internal validity?
In
Hmm.
increase internal validity comes with a like confounder. Uh, I don't know. Explain.
Okay. If we go back, okay, what are they look at the question? What are they asking us in the question? That's the first thing you always have to look at. Compared to unblinded trial, which of the
Trials.
following is which of the following is the effect of including a group of independent blinded
Yes.
trials? So basically, they're asking you what is the benefit of blinding the researchers versus non-blinding the researchers, right? That's
Yes.
kind of what they're asking you. What is the benefit, or what is the difference, or why do we prefer to blind the researchers versus non-blinding? If you go back to what you just read, we had internal validity versus external validity, and we had the threats, so the things that may reduce the internal validity of a study. So the truth about the study, the accuracy of the study. We had selection bias, whatever. We had the selection bias. You just read it. The people that you pick to put in the study, volunteer attrition bias, and all these things. The measurement bias, the tools that you use. You had observer bias or the record bias, whatever, and then you had the confounding. Okay, and then in external validity, what are the generalizability? What are the threats, the things that may uh, reduce the external validity of a study? So you cannot apply it to the general population. What are the things that can reduce that? And we had when you choose a special population, and when you choose a special whatever treatment. Then the next thing that you read was the type of biases, and you had three big types: selection, measurement, and confounding. In selection, you had the types of selection bias, volunteer, blah blah blah, Bergsonian, all these things, and you had how to overcome selection bias, how to make it better, randomization, and blah blah blah. Then you had measurement bias, the type of measurement bias you have: observer, recall, and author. And then you had how to overcome measurement bias. You had blinding the patients, and then choosing better tools, whatever, to analyze. And then you have confounding. So this is the blinding part is inside the measurement bias. But when you go back up here, the measurement bias is inside the threats to the internal validity.
Validity. Okay.
You see? So that question is asking you, why do you wanna do you prefer to blind the researchers instead of keeping them unblinded? It's because you wanna avoid, you want to overcome the measurement bias. And the measurement bias is a part of the internal
Internal
validity.
validity. Okay.
So if you the measurement bias is a threat to the internal validity. So if you reduce it, then you increase your internal validity. So you increase your accuracy of these results. That's why it's increasing internal validity. That's why I was asking you if you had you understood what you were reading here, because those two are kind of connected. The
Okay.
two.
This is a three-step type of question. A very good question. So first, for internal validity, first we will see the SMC, selection, measurement, and confounding. And in the measurement, there is blinding, non-blinding, isn't it?
O-
Blind.
Okay. If
Okay.
you wanna, yeah,
Yes.
if you, yeah, it makes sense to you like that, yeah.
I have to keep in my memory in a shortest possible way.
Memory in the show. Okay, as long as you can find the answer. Hey,
Yes, you now
yeah.
I understand everything, whatever is written in here.
Okay, perfect. Next. Or
Okay.
you have another question? Okay, next.
Now,
Okay, you can read, just read the explanation. This one.
okay.
Mhm.
Internal validity refers the ability of a study design to provide evidence of a causal relationship between the treatment, new drug, and the outcome hallucination. The internal validity of a study is threatened when factors other than the treatment can potentially explain the relationship in a study. One such factor is measurement bias, the misclassification of exposure and the outcome, labeling diseased as non-diseased and vice versa in study blinding. Those who collect or measure the data in a study reduces the likelihood of measurement bias that arises from being aware of the treatment assignment and consequently increases the internal validity of the study. In this trial, the participants diagnosed with severe Parkinson PD psychosis are randomly assigned to receive either the new drug or in placebo. The study employed a group of independent or blinding raters to administer the PDA adapted scale for assessment and positive symptoms. The measurement and the measure the frequency and the severity of the symptoms for all participants, blinding those who collect the measure of data to treatment. Each participant receiving reduce the measurement bias, which ultimately increases the internal validity of the study.
Okay.
Okay,
Next question, number
okay.
9.
ROC
What
curve, the last
ROC?
one.
Yeah, I think so. ROC. What are the answer choices? Wait. Oh, wait. No, no, never mind. Let's not look. Don't look at the answer. I guess those are the answer choices right here.
Okay,
Okay.
dynamic stimulation tests are typically used to diagnose adrenal insufficiency. The insulin tolerance test is considered as a gold standard test for hypothalamic pituitary excess. However, insulin tolerance test is unpleasant and potentially dangerous due to risk of hypoglycemia. A good, although more time-consuming alternative is the global stress test. A prospective study was conducted to compare the ITT insulin tolerances, and the GST. In the evolution of HbA axis in patients with pituitary disorder, both tests were performed within 7 days in 81 people. Serum cortisol were measured. Participants were divided into those with abnormal insufficiency and those with normal response on a predefined peak in the ITT ROC. Characteristics analysis was performed to identify the potential peak cortisol cut point value for the GST. The ROC curve analysis of the peak cortisol values of the GST in patients with pituitary disorder is the shown below. Sensitivity 1 minus specificity.
And then what is the question? Oh, oh sorry.
The, the labeled points
Mhm.
of the ROC represents 5 cut point values evaluated in the study. Which of the following is a peak cortisol level? Cut points represent the best diagnostic
The accuracy.
accuracy.
Which one? Okay, that's the
Accuracy
best.
is the specificity, isn't it?
Why you say that? I don't know what I don't know what you mean.
Okay, what's your answer? Is it B or C?
Mm,
Or how you
theoretical with the
calculate the
GST.
ROC?
That is the calculate. Do we calculate? It says the most accurate. Most accurate will be the one that has highest sensitivity and I guess the highest specificity. So it will be B or C. So it will be B has high sensitivity.
And high
Maybe
C, I think that C is the answer. C has higher
C.
sensitivity and higher specificity.
They say they both have the same specificity, I guess, but C has higher sensitivity. So yeah, I guess let's just see C. We are right. Okay, read. But do you understand why you got why right before we read it? Do you
Can
can you
you
explain?
define in the graph? Like
Oh, okay. Uh-huh. I think I get
like
what you're saying. Mhm.
if we put a straight line from that C point, then it
Um,
touches the point 9, which is the highest sensitivity. On the
okay.
contrary, if the B
Uh-huh.
point in there
Uh-huh.
is 0.7, that means 70% sensitivity, so it is low.
Uh-huh.
And if we put a straight line from B and C, it
Uh-huh.
touches the point 2.
Uh-huh.
Point 2, that means the 1 minus specificity, like point 0.8. So it is a high specificity and high. So that's how we calculate, isn't it?
Okay. Hello?
Yes,
It's starting up.
yes, I
I
can
can
hear you.
hear you.
I can hear you too.
Okay. 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 Yes, it's what you explained. Yes. What you
Okay,
explained is right.
okay.
Does it make sense? What
Yes,
why
yes,
C cannot be? Okay.
it makes
Perfect.
sense.
Okay. Now you can read the explanation.
Okay, there is another question. The best cutoff threshold for a quantitative diagnostic test represents the best compromise of the highest true positive rate and the lowest false positive rate. Lowest false positive rate. A ROC curve, highest true positive, lowest false positive. A ROC curve for a given diagnostic plot sensitivity on the y-axis 1 minus specificity or equivalently 100 minus specificity on the x-axis. Sensitivity is the ability to correctly identify with the disease as positive. It represents the rate of true positive or true positive rate. Specificity is the test's ability to correctly identify without disease as negative. It represents the true negative, therefore 1 minus specificity represents the rate of false positive or false positive rate. The cutoff of the best diagnostic accuracy is 1, provides the best compromise of the correctly identifying patients with disease as positive, highest true positive rate, and correctly identifying those without the disease and negative lowest false positive rate. Okay, I got it.
Okay.
This
It's perfect. Last question. I think. I'm not sure. I think it's the last one. Yeah.
a group of medical genetics conducts a study to detect the micro miRNA 29A expression in the plasma of patients with a lumbar spinal stenosis and to investigate the clinical significance. The specimens are collected from the patients with LSS lumbar spinal stenosis, patients with intervertebral disc herniation, and the healthy people. Reverse reverse transcription of quantitative polymerase chain reaction analysis is used to detect the expression of miRNA plasma. Several studies of the neuromuscular disease models have shown an association between the miRNA 29A and those with matrix metalloproteinase MMP9 and a disintegrin and metalloproteinase and thrombospondin motifs Adam TS5. So Western blot is to detect the expression levels of the MMP9 and the ADAMTS-M protein. Study results reveal that the correlation between the expression of MIR29A and MMP9.94 p value is less than 0.01, that the correlation between the expression levels MIR29A and ADAM TS5 is minus 0.5 by P is 0.01. Based on this result, which of the following statement is the correct? Uh,
Waiting on you.
Ready?
Yeah,
I don't,
which one do you want to do?
I don't know. You need to explain this. It is out of my mind.
Okay, let's go one by one for the on the question on the answers. Low expression of okay, I think the first thing to realize here is that is we are comparing numbers. So
Yes.
we are using that thing, that correlation analysis thingy,
Okay.
where a negative one, where negative means opposite correlation, one is going down, one variable is going down while the other is going up. And then positive means uh, both variables are going up or both variables are going down. And then if it's close to one, that means a strong association. If it's farther from one, that means not so strong association. Remember that one, that correlation
Yes.
analysis?
Correlation analysis. Yes.
Yeah. Okay, so it's I think that's what they're using here. I'm not sure. A low expression of MI whatever plasma is statistically significant is a statistically significant cause for low expression of blah blah blah. Just the fact that they use the word cause. In correlation analysis, you cannot find the cause of one thing. You cannot say that X is causing Y or Y is causing X.
Okay.
Yeah,
So we
yeah,
cannot find out the cause.
no cause. That's not yeah. You cannot find the cause. It's just an analysis where you're saying that one when Y is going up, X is going down, or when X is going up, Y is going down. You're just observing. You cannot determine that that means that Y is causing X or X is causing Y. So automatically, that word automatically uh, makes
Eh,
this statement incorrect.
Okay.
Makes sense?
Yes.
Okay. Next statement about 94% of variation in the expression of blah 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 uh, and the expression of MM9 and 55 in the expression of Adam TS13 are explained by the expression of, I don't know, in the plasma. So they are using these numbers to say that, but we know that this is not, this is, I was confused on that one. So let's just leave it. Let's say maybe it's right, maybe it's not right. Okay, C. Lower expression levels of MI29 in plasma tend to correlate with higher levels of MM9 and Adam TS13, whatever, and vice versa. If you look at this number, is negative, whatever. So if we
Yes.
go back to the correlation thing, that means that negative one, once is going up, the other one is going down. So basically, we can say that once MIR is going up, the other one is going down, or
Down.
once this one is going up. Basically, they're both going in different directions. So that's what the negative sign means. And 1.94 means that it's closer to one, so it's they're kind of correlated. That the correlation is strong, basically, you know. And that's
Okay.
what they're saying on this statement. That once one is going down, the other one is going down. Lower MI means higher MM9, and lower MI means higher Adam TS5. Remember, look at Adam TS5 also have the negative sign. So that means one is going down, the other one is going up. So that can, yes, it can be one of our answers because the statement is true, right?
Yes.
Yes. So with that, okay. So we have two that maybe that's those are where we think. D, there is statistically significant positive linear relationship between expression of MI and expression levels of MM9 and Adam TS, whatever. Positive linear. We're seeing here is a negative
Negative.
one.
So it is
That already
cancel.
takes away this is zero. Next, there is not a statistically significant
No,
linear
it is
relation
statistically significant.
with
P-value is
an insignificance. So we can already so you are left with these two. I
yes.
just picked this one because this I didn't understand what B means, so I just picked C. But yeah, because I don't understand what that meant by B. So
Let's
now
see
it's
the
your
answer.
turn. The answer. Oh my God, that I did wrong. Okay, no, I got it. C,
You
C,
got right.
is C. But you saw how we eliminated all the other ones, right?
Yes.
Okay. So I guess the only confusion is B. So that's when you're gonna read it. Oh, and that's the correlation thingy that I was telling you about. I feel like you've seen this probably somewhere in your work already.
Yes,
Yeah.
it is in the first state. Okay, I should read the option B first.
The option no, read the explanation first and then you read B. Maybe
Okay,
it helps.
the
Oh,
correlation.
read
Yes.
the red
L-
thingy. Really important.
okay. Linear association never implies causality, so it will never show the cause.
Mhm.
The correlation coefficient describes the direction, negative and the positive, and the strength values closer to 1 indicate stronger relationship of the linear relationship between two quantitative variables. R less than 0 indicates one variable increase, other decreases. This means the lower value of one variable tend to relate with higher value of other variable and vice versa. R more than 0 indicates both variable increase or decrease together.
Makes
This
sense?
means the yes,
Mhm.
lower values of one variable tend to relate with the lower values of the other variable and vice versa. In this study, results reveal that the correlation between expression of microRNA 29A and a matrix metalloproteinase MMP9 in plasma is 0.94, and that the correlation between the MIR29A and disintegrin metalloproteinase with the thrombosponding motifs in plasma is 0.55 minus 0.55. Both correlation coefficients are negative and statistically significant, and therefore there is a significant negative linear relationship between the expression levels of the miRNA 29A, expression levels of the MMP9, and the ADAM-TS5 in plasma. This means the expression of MIR29A increase the expression level of the MMP9, and the ADAM-TS will decrease. As a result, lower expression of the MIR29A plasma tend to relate with the higher levels of MMP9 and ADAM-TS5 in plasma and vice versa. However, a significant linear relationship between two variables does not necessarily imply the causality.
Does all that make sense?
Yes,
Okay. Now choice B.
the values of minus 0.94 and 0.55 correlation coefficient, they describe the direction and the strength of the linear relationship between two quantitative variables. The static that describes the percentage of variation in a variable that is explained by another variable is the coefficient determination, which many cases is equal to the square of the correlation coefficient. Educational objective: the correlation coefficient describes the direction, positive, negative, and the strength of the linear relationship between the quantitative variables. Okay,
Okay. Makes sense.
so
I will
we are
have
done.
with this thing.